Turning now to our next guest. She is on a mission to tackle food insecurity in South Florida through her nonprofit. I love the name of this. It's called Health in the Hood. Asha Walker has transformed 8 vacant lots into large vegetable gardens. The group distributes free produce to neighborhoods known as food deserts, where it's difficult to get fresh food. A mobile farmers market also provides information about cooking and healthy eating. In her 2019 TED Talk, Walker talked about the challenges facing people who are surrounded by unhealthy options like fast food.
My husband and people who live in food deserts are the most susceptible to these options because they are readily available in their communities. So what does that look like on the ground? It looks like families that are stuffed but starving. They're stuffed because they've consumed highly caloric meals. They're starving because those meals contain little to no nutrients and instead are packed with sugar and sodium and dangerous preservatives. If you live in a food desert, your priority is the price tag, not the ingredient label.
Now, the CDC says your zip code, listen to this for a second, can have a greater impact on your health than even your DNA. What? Food deserts contribute to a number of chronic conditions, including heart disease, diabetes, and obesity. And only on CBS this morning, Health in the Hood founder, I love the name of your company, Health in the Hood founder, that would be you, CEO, Asha Walker joins us at the table. Thanks, Asha. It's really good to see you.
Welcome.
It's so good to see you.
So I like this part where it says that, this is surprising to me, that your zip code can have a greater impact on your health than your DNA. What does that mean exactly?
It means that where you live completely dictates the kind of food that you have access to. It's really that simple. If you're living in a neighborhood that is cut off from healthy, fresh greens, you're not going to be able to consistently eat healthy food.
And you get diseases like, which you say are preventable.
Preventable. Diabetes, heart disease, stroke, obesity, they are totally preventable and oftentimes linked to diet.
So how did this come to your attention, Asha? Because, you know, I look at neighborhoods and if I see a empty parking lot or a dirt, you know, filled with nothing, I don't see beauty in that. You look at that and you see what?
I see a community asset. I see an opportunity that's not being taken. I see an opportunity for a vibrant vegetable garden. So for us, creating a sustainable resource in a community that doesn't necessarily have them is a really simple solution to a big problem.
So you literally go knocking on doors.
That's it.
Take us through your pitch. It's you and your dog.
It's sometimes me and my dog because we got to make sure we're safe.
Yes.
But we'll knock on doors as we're really, community engagement is a huge part of what we do. So we're knocking on doors. We're finding out what people are interested in.
And what do you say to them? Hi, I'm Asha. What do you say?
Just that. Hi, I'm Asha. This is Bailey, and we're going to be growing some collard greens across the street.
Yeah.
Are you interested in anything else in your neighborhood? Do you have any growing experience? And do you want a job? Because we're also creating jobs for residents in neighborhoods that are food deserts.
How has the pandemic affected these food deserts?
You know, it's interesting. People who live in food deserts were already struggling to access food and struggling to access healthy food. So this really only exacerbated it. And I think the biggest difference is that there are just a new population of food insecure individuals. So it's a whole new audience of folks that are not able to access healthy food.
Asha, I was shocked when I read that there are hundreds of food deserts in South Florida alone. How big is this problem? And Michelle Obama brought a lot of attention to this when she was in the White House like 10 years ago. Yeah. What kind of impact did her work make? And, you know, how bad is the issue now?
Well, we're moving the needle, but Michelle really sort of opened the door for all of us, and we're walking through us. Food insecurity warriors, we're following in her footsteps. And, you know, our work is trying to move the needle to make sure that we are increasing opportunities to access to real food. But it's still a struggle. And in Miami, there are over 300 food deserts, and this is another type of pandemic that we're dealing with.
When you got a food truck, you say it changed the game for you.
It did.
What happened?
It made us mobile.
Yeah.
So we've got 9 farms in South Florida. Yeah. This made us be able to connect them, reach other communities, and to help people come on board and make it a really interactive experience. So our mobile food truck made a huge difference in our ability to reach communities.
But what is your backstory, Asha? How did you even notice this, honestly?
You know, it was...
Were you food deprived as a child?
I was
Vegetables?
not.
You were not.
I was not. I was a very lucky young child. I had access to all the broccoli I could ever want.
Yeah.
But I come from community-minded service people, and we always knew that you could convert vacant land into vegetable gardens. And for me, it was my drive home from work. I've always been in nonprofit work. And from my 3-mile drive home from my office to my house, I passed through neighborhoods where you could access fresh food, you could get all the kale you want, and neighborhoods where you could get no kale. So the disparity was just too jarring. The juxtaposition was too great. And I said, but there's a vacant piece of land there. Why are we not using that?
And what does it do for the people? There's something that happens with the people, too, when they get to participate.
Yeah, it's incredibly empowering. We are providing and growing a sustainable resource in communities that are often thought of as marginalized and disconnected. This is the complete opposite.
Do you find people get drawn in easily?
Absolutely.
Yes.
We have an innate sense that connects us to our food. And so when you're putting your hands in the soil and creating your own food and working with other communities, it is this great equalizer.
You call it an equalizer. What do you mean by that?
I always say that. I say food is a great equalizer because we work with so many communities and we have so many amazing volunteers that come in. When our hands are in the soil and we're creating food, we're all the same.
And everybody has to eat.
And everybody has to eat. And you've got AshaWalker.com because you're working on this and wellness for all of us.
Yes,
what
exactly.
You want to do.
Yeah, it's really the bridge. So it's my personal wellness platform, and it's really the bridge between Health in the Hood and sharing more wellness practices with an even broader audience.
Health in the
Asha
Hood, I
Walker,
love that.
Thank you so much.